Well, good day, Rotary family. A magic day as we get started talking about our #1 corporate priority, and I couldn't be more proud and excited for you to be able to meet my very good friend, Dr. Hamid Jafari, today, and for us to have a conversation about our #1 corporate priority. So, Dr. Hamid, we have just wrapped up 2023. The progress has been impressive, despite some difficulties that we've had in the challenging 2 countries where we still exist. We ended this year with 12 cases of children paralyzed by the wild polio virus, 12 too many, in Afghanistan and Pakistan. So the big question I think we all want to know, we are set to finish by 2026. Are we on track?
Thank you. And first of all, I really want to thank President Stephanie for this honor and this invitation to the Rotary Assembly. And I'm absolutely thrilled that past President Jennifer Jones is interviewing me today. So really, it's an honor to be here. I think just responding to your question, clearly the timeline has gotten tight, but I believe we can still end polio by the end of 2026. And I say this because when I assess a program, I look at 3 fundamental elements of success. First is the epidemiological progress against the virus real and sufficient? Second is that are the programs that are responsible for delivering polio eradication, are they strong enough to overcome the challenges that they are facing? And third is, do we have the political commitment and the financial resources in place to achieve success? So let me walk you through each one of these key success factors. In terms of the epidemiological progress, we had 140 cases of wild polio virus in Afghanistan and Pakistan in 2020. We finished the year 2023 with just 12. We had 16 distinct genetic clusters or tribes of wild polio virus in 2022 that were circulating across these 2 countries. We only have 1 remaining in each country.
It's amazing.
So elimination is happening. The polio virus is restricted to just a handful of districts in parts of Pakistan and parts of Afghanistan. And the virus in Pakistan, the indigenous virus, has not shown its face outside just a couple of sub-district areas in 2023.
Right.
So the spread we are seeing is really from the travelers coming in from Afghanistan, which are very sensitive environmental surveillance is picking up. And both the programs are not allowing this virus that is coming in from outside these endemic sources to reestablish circulation. These programs did this last year, and so the progress is truly compelling. Now, the second question, are the programs in Afghanistan and Pakistan strong enough? And I believe that currently these 2 country programs are the strongest we've ever had in the polio eradication program. They are demonstrating incredible resilience, innovation, and operational excellence in the face of mounting insecurity, political, and social challenges. And they're still making progress. And then finally is the political commitment in place. And we are seeing the highest level of sustained political commitment in Pakistan, despite 3 changes in government only since April 2022. The army is fully engaged, the administrative setup is, there is political consensus in the country, and in Afghanistan, we have access everywhere now, across the country. And the role that the Rotarians have played in securing this political commitment, particularly in Pakistan Rotary leadership, your visit in summer of 2022, and of course the incredible work that Aziz Memon is doing in helping us cross the finish line is truly incredible. Financial resources is where we are short, and that's where I think the Rotary magic comes in.
I love that you use that. And we all heard President-elect Stephanie talk about her commitment to going to Pakistan early in the Rotary year ahead. So I personally believe, I know you do too, that the public health infrastructure that we have created across the globe in more than 70 countries will perhaps be even the larger legacy in a post-polio world. So how do we protect this as we move forward?
Absolutely. I think the incredible public health infrastructure that Rotary has helped build over several decades has already saved millions of lives from other vaccine-preventable diseases, the pandemics that we have gone through, protecting children and families living in conflict zones, and during humanitarian crises. And the most important lesson about sustainability is what I learned in India. When we succeeded in eradicating polio in India, the government stepped up, and other partners and donors stepped up to sustain that infrastructure that is playing an important role in public health in India right now. I believe the same will happen globally. Once this infrastructure delivers on polio eradication, there will be many more interested parties to help sustain it, and the government will own it.
And that's once we eradicate it, because
Yes,
we
yeah.
need to keep our foot on the gas pedal until we cross the finish line. Fatigue aside, we have a big job still left to do. So we're here with Rotary district leaders from around the world. So what's your message to them, and what would you like them to take home and convey to their members?
These Rotary leaders are really in a incredible position. And you know, the first thing I would say is to please convey the message that for anything that is monumental, that's phenomenal, progress is never linear. You know, you go forward, you come back, and you probably know this from your investments in the stock market. So progress is never linear. So I think it's important to stay the course. Secondly, I think it's very important to keep the eye on the prize and continue the incredible support that Rotarians provide to the program. But I think the third one is the most important one. You know, there are young women and men, our frontline workers, our staff, who are working in some of the most dangerous conditions in the world. They're putting their lives at risk. Lives are actually being lost in the pursuit of this eradication goal. It is extremely important, and you, as Rotary leaders, to make sure that these frontline workers and staff palpably feel the support of 1.4 million Rotarians that are there. Please mobilize them. Their contributions, their political support, their advocacy will be huge for the morale of this workforce to deliver on this promise.
I want you all to know that Dr. Hamid flew in yesterday from Pakistan, where he was located doing some field work. And, you know, as we all know, flights have not been easy right now, missed flights and all sorts of different things. But he came specifically to talk to all of you. And I think it's incredibly important that our partner in WHO is here to be able to share with you the importance of what we do together. And you and I spent time in Pakistan, as you mentioned earlier on, just over a year ago. You just mentioned the importance of female health workers to the delivery of immunizations and health care. In the National Emergency Operations Center in Islamabad, there is a wall of martyrs, and it's over 45 photographs of women and a few men who have lost their lives in this work.
Yes.
Tell us about why it is so important. Why are female health workers so relevant in this work that needs to be done?
I would say that they're not only relevant, they are critical and essential for the success of the program. That's because they bring an extraordinary level of work ethic, transparency, and commitment to their work. But most importantly, they have incredible access to families, mothers, and grandparents. They have physical access. They have emotional access to young mothers, to families, to build the trust and confidence in the vaccine and the vaccination program. And they have access for trust. They build incredible trust for the program, and they de-conflict the program. The program is operating in highly contested areas. There is insurgency there. When we bring women into the front lines, there is so much de-conflicting that happens that families open their doors.
Well, like you said, it's building trust, that mom to mom, individual, human to human. And I want to take a chance as we close out this session today to offer my incredible gratitude on behalf of all of my colleagues here to you for the leadership that you have provided, for our incredible partnership with the WHO, and more than anything, as you're walking through the hallways and you see Dr. Hamid, please take an opportunity to offer your gratitude to him and to take a chance to say hi and let him know how much it means that he's been here with us today. Thank you so much.
Thank you very much.
Here.
It's been an honor. Thank you.
Thank you.